welcome back to everybody. I hope you had time to catch up and grab a coffee, to discuss with some people, and the idea was to network and take opportunity today to meet other people from other continents, from other sectors as well, to be able to develop projects. So we will now enter in a new track of this program, this agenda. Actually, we started with Samir just before the break. We had the point of view of the WHO on what happened in the pandemic in terms of global digital health, what is the strategy of the WHO, and what is the vision. This part of the agenda, so from now to lunchtime, will be the opportunity to understand what are different points of view of the evolution of digital health. We all have observed that since the pandemic, but as well a bit before, digital health was coming more and more in a routine mode, not anymore like 10 years ago in pilot mode. We had 10 years ago when we start a description and presentation of thousands of pilots, and some people were talking about pilotitis, so a kind of disease of piloting things, but never implementing things. Now I think we are much more mature, and this is the title of this track. Digital health could be a mature market, or more mature at least than a few years ago. So we will try to discuss this with different points of view, from a private sector investor point of view, and we will start with Sarah in a few moments. Then with Armand from the American Telemedicine Association, from a US point of view and a global point of view, because Han is very involved in different global initiatives, and from a European and especially French point of view, because France is ensuring the presidency, we discussed that before, to see a bit the agenda in Europe. So the idea of this track is to understand from investor, from US, from Europe, what is the state of play and how digital health is more and more mature at the moment. So, to start with, I'm very pleased to welcome Sarah Sekol. She's general partner in Hiver Ready. We can applaud Sarah.
Hi.
Welcome, Sarah.
Hello.
Should
we sit
take
here?
a seat, yeah.
Right.
So, we will have a discussion without slides about your activity. You're a partner at Hiver Ready. You're investing in this organization since almost 15 years in digital, in life sciences, and in digital health in particular. You have invested a lot this last year in startups in Europe, in Spain especially. And we wanted to understand a bit what is your vision, the state of play of the market at the moment. So perhaps first question, Sarah, since the pandemic, we have observed a growth in the digital health sector. How did you appreciate this growth, and what are the characteristics of this growth recently?
Yeah, the pandemic has totally accelerated this sector. We've seen it in the types of services that users have used, and we've seen it at our own companies that have started coming into this sector and deploying really what they had already in storage. So, for example, Meeting Doctors, a local company, went and doubled the amount of users they have, up to 7 million, and that's been a constant across companies offering telemedicine. Telediagnostics, it did lower a little bit at the beginning because of the lockdowns, but then there was an uptake again in telediagnostics. So we've seen tremendous growth lately in adoption of technology. These companies in turn have used the increased revenue to develop new technology, more sophisticated if you wish, so that their portfolio of products, excuse me, that's coming in the next years will be more sophisticated solutions for this current market that's a clear reality as of today.
Yeah. Okay. And in which where did it grow? What are the sector? What are the levels of this growth you have observed?
As far as drivers, obviously in the last 2 years, it's been the hard reality of being at home and needing services and being able to uptake them through telemedicine and teleconsultation. But in the future, what we see is different levers. I think that will come to play. And one of them is reimbursement. I think that will be a clear lever for growth. So we see more and more healthcare systems, like Germany, for example, reimbursement, digital technology, France as well, and here in the short run too. But also pharmaceutical companies coming into the sector, maybe to monitor their beyond the pill, to see how their medicines are doing in the market in real time. We also see an empowerment of patients, and more we want to own our own data and own our own health. That comes, I think, from the shift of the natural movement from well-being into healthcare as we age, right? So a lot of us, most of us will have an interest in monitoring and taking ownership of our own health. So I think that's a big one. And maybe lastly, we see a lot of new entrants too into this market. So all of those companies out there, telecom and banks, retailers, they're out taking technology maybe to offer a bigger suite of products or just to increase customer loyalty, cross-sells. So I think all of those are levels for growth in the next few years.
And these new players, how do they behave with the startups? What's the kind of relationship they build with these startups?
Well, all sorts of relationships, from purely funding them to developing solutions together, to just being one more platform for their client base. So we see them acting in a number of ways with these startups.
And I ask because for an investor like you, a partnership between a startup you might invest in and a big pharma, let's say, or a big telco, is a plus in the evaluation of the. It's an advantage for the startup in the evaluation of this case.
That can be an advantage, but there's plenty of funding. So the funding itself, and we'll see it later on, but there's an advantage to having an industrial partner because of their client base. And definitely we've seen that, say, in Meeting Doctors. They do have a partnership with MásMóvil, a local number 3 provider of telecom. That's one example where they benefit. We've seen Telefónica invest in Volava healthcare, home healthcare or wellness sort of companies. So we see them coming as an advantage for our portfolio, but also for the uptake of technology at large.
Yeah, and they come with their network, with their market, and
True.
so a combination is
Yes.
interesting. Actually, to follow up on that, do you see an evolution of the business models in this sector in the recent years? You spoke about reimbursement models, and you spoke about partnership with big companies. Certainly, innovation
Yes,
there.
it's all a bit. All things are up there for grabs, right? But we see still a lot of B2B. I think most of the business model are based on a B2B model, some B2C, but by and large B2B. We see services, software as a service, so SaaS models being important. We do see also pay per visit or per care or per use. So we do see some of that, but and then of course all these business models might change as new entrants come in, right? So yeah, there's a bit of everything as far as business models, with a heavy, I would say, 2 key points: B2B and SaaS and cloud services.
And another question about business models. In the academic or scientific field, we talked since many years about the models, outcome-based models on business models, so where the service provider, we share the risk, and especially in healthcare, it has been
Right.
test and pilot. Do you see that concretely implemented, or is it a chimera a bit?
I think we're still at the very beginning, but the intention is there, especially for reimbursement. So I think we'll see more of that. But as it is of now, I see little in our portfolio companies at this point.
Okay.
Yeah.
Maybe, and do you think that the public payers, if we talk about Europe, mainly there are public payers for social care and healthcare. Do you see them as ready for this kind of innovative business model discussion?
They take their time, especially here in Europe, to adopt new technology. But I think one thing that the pandemic has clearly done is shown that there's efficiencies to be gained by using telemedicine or telediagnostics. So, if you decrease the number of visits by a certain amount, every visit is at least 30 euros, right? So that's a clear cost efficiency that the national healthcare system needs to be thinking about, because we can't run the expensive bill that we're running at this point, especially with an aging population. We've also seen, and that's what we see in some of our portfolio companies I was mentioned, they're developing AI technology to, for example, screen ECG. So if you can actually demonstrate that the 70% of electrocardiograms that are usually normal, but that a doctor will prescribe to a patient, and if you could screen those with AI, clearly there's a cost advantage derived from an efficiency of a machine doing what an electrophysiologist has just to sign up at the end. There will always be a doctor at the very end, but for an amount, there's an amount of work currently that we can currently measure that's being actually identified or analyzed by human eyes that could be analyzed and screened by machines. So that creates an efficiency, and we see public-private partnerships developing these technologies or helping develop them. So I think we'll see an uptake because there's a clear efficiency that then is passed on to the healthcare provider as a cost savings.
Okay. So we talked about the impact of the pandemic situation, the crisis on the market of digital health. What was the impact on the funding activity, on the VC's world, on the world of investors? What did you observe there?
We've observed in the last, there's plenty of data points that I could give you, but if you look at M&A, and I'll give you the last 10 years, it's gone from almost negligible to 100 transactions in Europe in the last 10 years.
Okay.
And if you look at the number of funding rounds, it's gone roughly from 100 to 500 funding rounds. But if you look at the amount of money that has been put into these companies in the last 2 years, so due to the pandemic, it's about 9 billion, which is it's more than in the last 10 years before.
So cumulatively, you mean?
Yes, cumulative, right? So if you look at the amount of funding and the number of rounds, you can clearly see that there's been a pouring of investment into this sector in the last 2 years. And lastly, if you look at the number of companies that have been funded, again, it's gone from around the hundreds to 2,500, I think, last year. So there's a lot of companies coming into the system. There's a lot of them being very well funded. And I think that lays the ground for a lot of new technologies, especially I think in AI and the use of data to come into the system. From moving from teleconsultation, which is what the reality today, to more complex technologies.
Yeah. Well, especially these subsectors of digital health, which are the ones who receive in Europe or in Spain, for instance, to take this example, what I receive the more money?
That's interesting because you still see it. We were analyzing our own data set here in Catalonia. We've seen a tremendous increase in funding, but it's still a very small country, I'd say. So the numbers last year were about 60 million invested in digital health. And if you look at where the pie sits, it's very evenly distributed between telemedicine and wearables and wellness. So there's no clear bet on any of the subsectors, particularly at this point at least.
But maybe you see the same types of technologies within each project, even if they are not addressing. For instance, we see that most of the solutions we are showcasing now are involving AI, are involving machine learning, for instance.
And that's clear what you see. And one derivative is, for example, going from wellness and following your heart rate or your number of steps and what have you, into monitoring your chronic disease, for example, diabetes. Or what I was mentioning on our company, Athletes, they're developing AI to discriminate and screen ECGs from of normal to the abnormal, that where the doctor, the electrophysiologist really needs to look into the data and see. And they're not only developing that, but they're also, and this is across companies, they're developing system by which we can see human error in diagnosis, or we can really see what's background noise and what's good data, maybe data that's blind to the human eye, but AI can actually help us. The data is already there, but we can't see it. So there's a bunch of new technologies that are coming that I think are really exciting in the next 3 to 5 years.
Yeah, good. We maybe can take some questions from the audience. Feel free to integrate Sarah on the question of funding. I'm sure we have startups trying at the moment to find investors in the room. Maybe Sarah, just to trigger a question. What is the kind of advice you usually give to startups when they present to you the first time, in terms of how to present their project, or how to think about their project and to develop it?
It's good that you asked this question, but I think more and more startups are more prepared to come and talk to investors. So in the first meeting, I like to know what's different about your technology, so a clear benchmark against your competition is very important. And sometimes there's some barriers to entry in this sector, but still, if you come with a solution that has a real advantage as far as efficiency, gaining efficiency, or looks at a niche market that's attractive at this point, or a clear cost cutting, that's what we look for. We also look for revenue streams that are clear and recurrent, hopefully, so a good business model to back it up. And one thing that may seem very simple, but sometimes companies don't come ready to answer, is how much money do you need to come to the next value inflection point? So that's very simple, but sometimes in our first meetings we don't get a clear idea as to how many rounds of financing will you need to get to a real inflection point.
Yeah. Any question? Yeah, here, microphone, please. If you can mention your name in your organization before your question, please.
Okay. My name is Bettina Horster. I'm from Germany, and my company is Viva.care. And I was wondering how, with BioNTech and Pfizer, you saw, a big corporation and it was not a startup, but a small company. It worked really well. Is that a model that you think is viable? Because, in the healthcare sector, we are in the healthcare sector too. It takes a long, long time until you get a product that is really marketable. We are working on our product already 6 years, and we are not on the market yet. So it takes so long. And if you hear private equity, 3 years and you have to exit, that really doesn't work. So what's your idea on that?
Well, I think it's interesting. You're pointing to half of our portfolio in life sciences, which is developing molecules, and there's a very well-established licensing out model for these technologies. So here we're more talking about digital health, which is a totally different business model, and I think the path to revenue is a lot quicker. But for developing therapeutics and molecules, the BioNTech-Pfizer partnership is very common across the sector, with biopharmaceutical companies licensing out technology when it's prime for uptakers to take. So that depends on the time. The pandemic was a very special time where vaccines were needed in a rush, and BioNTech had the technology ready that they had been working on, by the way, for 20 years. So success comes usually late and after many years of academic work and then company work, right? But most of our companies in our portfolio are developing new molecules, and the model is clear. We take them from, they have a proof of concept in an animal model all the way to a proof of concept in a clinical trial with humans. And at that point, if the data is good, you're likely to have a potential for a licensing agreement. We've done that with Palo Biopharma, Horizon, and it's a very, very common, and you can actually make a lot of money doing that. So I encourage you to continue pursue your interest.
Thank you very much. One last quick question, please.
Hi, good morning. Magallo Di Eugenio, Home Medicine from Italy. My question is about if you looking also to support business model or company already taking charge of patient at home, combining technology, or you just follow technology. And because we are integrating technologies to give better care. And about the empowerment of patient, I was curious about what you already have supported as companies.
I'm not sure about your second question, but I'll ask the first
The
question.
empowerment of patient at home. You were mentioning that you were supporting some companies about this matter.
Right.
Or you were looking for.
I think that's a lever for growth.
Okay.
But it's clear, a lot of us are following the path of controlling our well-being. We're not sick, but we're controlling our well-being, and naturally we'll transition into a point where we'll have chronic disease. Most of us will end up there. So we will naturally transition into solutions that will help us monitor our health, and I think that's just a natural transition. So
Okay.
for one, these newcomers, companies that are working on wellness, will naturally transition into healthcare monitoring and maybe at-home patient monitoring. That's one. When you mentioned technology for identifying how a therapy is working, is that what your question is?
No, we're going to push more the business model because we are combining technologies that we are, scouting all around, even in this trade show. But we really take care about the business modeling because we already have patient at home. So do you also give more importance, or you're just looking for technology-driven startups?
We love seeing an early application or indication, so in a killer application or niche market. So these platform technologies have usually have many ways to go. And as venture capital investors, we like to see what's the potential either low-hanging fruit that can start validating your business model and bring some traction to your technology, or a niche market, for example, where your solution is really key to increase efficiency, lower costs, etc. If that answers your question. I know we're running out of time, right?
Sorry?
Are we running out of time?
No, no problem.
Right.
No problem. It was important to.
So I hope I
Thank you for the
answered your
question.
question.
Thank you.
I invite you perhaps to discuss as well after
right.
this. We are running out of time for sure. Thank you very much, Sarah, for your
Thank you,
insights.
everyone. Sure.
It was very interesting.
Yeah.
We can applaud Sarah. Thank you
Thank
very
you,
much.
everyone. Have a good conference.
Thank you very much.